So just talking about population, we have already said हम number 1 हो गए 2 से. And besides this, we have emerging health profile and profound political, economic, and social transformations that are taking place every now and then. And besides this, as we talked about, कि rural areas में health facilities नहीं हैं, कम हैं, and we know most of the people are staying there, majority of them. So there is, despite several growth-oriented policies which have been adopted by government, the widening economic, regional, and gender disparities, they are posing challenges for the health sector. Still, if we don't talk about urban areas, still in rural areas, there is gender disparity in even approaching the health facility. So there should be coordinated action on 7 priority areas for improving environment for health. One of you has said about Swachh Bharat Abhiyan. Then besides this, we have balanced healthy diet and regular exercise, which abhi हमने बात की. Addressing tobacco, alcohol, and substance abuse. Yatri Suraksha, because there are so many accidents due to which there is high morbidity and mortality. So preventing deaths due to rail and road traffic accidents. Nirbhaya Nari, action against gender violence. Reduce stress and improve safety in workplace, and reducing indoor and outdoor air pollution. So we had, I just told you about 2 programs. One was leprosy eradication program and one was tuberculosis elimination program. So these are launched by Government of India for control, elimination or eradication of communicable disease, environmental sanitation. There are programs for nutrition, for population control and rural health. And the National Health Policy, it reviews the improvement in demographic trends, control of infectious diseases and growth of infrastructure. So for this, we had we had a policy of National Health Policy of 2002, which envisages that by 2010, the public investment in health would reach 2% of the GDP. What is GDP? Gross Domestic Product. And जो हमारी 2017 में आई है, it says we wanted to reach by 2.5% by the year 2025. So we are gradually increasing that so that we can invest more for health. So when we are talking about all this, we need to know what health is. So health is a state of complete physical, mental, and social well-being, and not merely absence of disease or infirmity. And this has been given in 1948, and this stays true still. Why given on 7th April? What is the importance of 7th April? पढ़ा होगा आप लोगों ने. What is there on 7th April? Answer वैसे यही लिखा हुआ है इसी लाइन में. What is 7th April celebrated as? World Health Day. और क्या कुछ और? You are somewhere near the answer. What is this? WHO? World Health Organization Day. So हम 7th April को celebrate करते हैं every year, and this definition of health has been given in 1948 by WHO. So if we talk about of policy, it is a statement of an authority adopted by government or public in order to improve the health services. And the National Health Policy, if we talk about, is just expression of goals for improving the health, the priorities among these goals, and the main directions for attaining them for a nation. So if we talk about the history, as I told you, I'll be just telling you कब से हमारा शुरू हुआ. So this health planning in India, it can be seen or divided as pre-independence and post-independence. So health planning that occurred before independence is health planning in India in the pre-independence era and health planning in India in the post-independence era. कब मिली थी independence? I hope everybody remembers. 15th August 1947 और WHO की हेल्थ की डेफिनेशन कब आई? 7th April. तो हमारी इंडिपेंडेंस के जस्ट बाद नेक्स्ट ईयर वी गॉट द WHO definition. So if we talk about health planning in India in the pre-independence era, in 1885 it was first time that a first public health act was made. It was the Quarantine Act. I hope everybody knows the meaning of quarantine. The COVID has made everyone learn this. What is quarantine? Is quarantine isolation? Isolation of? What is quarantine? Isolation of diseased people or healthy people? Disease free people or diseased people? कौन कहता है disease free? Just raise your hand. Nobody says disease free. So disease free, only two. Disease free को क्या बोलेंगे? Disease free people जो suspects हैं. Suppose as we were having in COVID, there was a person in contact with a patient of COVID. तो हम उसको क्या करते थे? Isolate करते थे या quarantine करते थे? Quarantine करते थे. Isolate किससे करते थे? जो disease था. Then after 1825, in 1880, we had the Vaccination Act. In 1864, that was before 1880, we had the Public Health Community, and 1873 we had the Birth and Death Registration Act, and in 1886 we had Plague Commission Act. So these were the various policies in the pre-independence era, and then in the post-independence era, we had national health committees, we had planning commission, we still have planning commission. 5-year plans, are they still continuing? 5-year plans? Now we don't have 5-year plans. Initially we were having 5-year plans also, and we have the national health policy. So it is the joint WHO and UNICEF International Conference in 1978 at Alma-Ata, which is at present in USSR, Russia. It declared that existing gross inequalities in the status of health of people, particularly between developed and developing countries, as well as within the country, is politically, socially and economically unacceptable. तो ये बात हम 1978 से कर रहे हैं कि we want to bridge up the differences, and still today we are talking about it. We want to bridge the differences between the rich and the poor, between different genders, between the rural and urban areas, and so on. So the Alma-Ata Declaration called on all the governments to formulate national health policies according to their own circumstances to launch and sustain primary health care as a part of national health system. Like nobody can say कि ये एक program है, इसको everybody has to launch. It has to be according to their own regional problems, their own circumstances. क्योंकि हर area की problems अलग हैं. India में we have a different set of problems. अगर India में भी हम बात करें, different states have a different set of problems. So it is according to their own circumstances. So the first national health policy in India came in the year 1983, that is 36 years after independence. So that was the first national health policy. So I'm not going into the detail of these policies. So we had the 1983 policy, national health policy. Uske baad, around 20 years later, we came up with National Health Policy 2002. And after that, around 15 years after, we came up with the National Health Policy 2017. So the first National Health Policy, which came in 1983, it focused on increasing role of privatization. Then it was revised in 2002, and the key strategy was focus on primary health care and equitable access to health services. कि सबको equally accessible हों health services. ऐसा नहीं कि केवल rich के लिए ही है या urban लोगों के लिए ही है, ऐसा नहीं. It should be equally accessible for all. And as per National Health Policy 2017, the aim was to inform, clarify, strengthen and prioritize the role of government in shaping health system in all its dimensions. So the main goal of National Health Policy 2017, which is we are having at present, lowering the cost, improving the quality and increasing accessibility. That is attainment of highest level of health and well-being for all at all ages. चाहे से वो elderly हो, चाहे से newborn हो, child हो, middle age हो, it should be for everyone. Universal access to good quality health services without anyone facing financial burden. इसीलिए ये जो आप योजनाएं बता रहे थे, they were not policies, कि चिरंजीवी योजना या RGHS, they are like tackling to this कि किसी कोई भी for any individual ऐसा ना हो कि उसे हेल्थ केयर सर्विसेज इसलिए अवेलेबल नहीं है कि वो फाइनेंशियली वीक है. So it focuses on good health for general population without any emphasis on bearing of cost by the public. Now, our focus has also shifted from sick care to wellness. हम केवल ये बात नहीं करते कि हमें सिक को ही जो बीमार हैं उन्हें ही ट्रीट करना है. We want everybody to be well also. So for that we have palliative care, we have mental health, geriatric health, rehabilitative care services, and we have focus on non-communicable diseases also. क्योंकि over the years communicable diseases तो हम control करते जा रहे हैं, but what we are looking at, क्या trend हो रहा है अभी? A rise in non-communicable diseases. So we are shifting our focus to that also. तो ये हम जो बात कर रहे थे शुरू में, some areas where we are focusing our policy. Swachh Bharat Abhiyan, which was started on 2nd October 2014. So we will be completing 9 years this time. Balanced and healthy diet, which we are providing through Anganwadi centers and schools and regular exercises. You will be going for your visit to Anganwadi center. Anganwadi center और even schools में midday meals होती हैं, जिसमें हम उन्हें supplementary nutrition provide करते हैं government schools में. Then this is again a very challenge for all of us. We need to address tobacco, alcohol, and substance abuse. So to you also, all of you, I would suggest just try to be out of this abuse. हम सोचते हैं अभी तक हम स्कूल में थे, घर पे थे, हमारे पेरेंट्स हमें मॉनिटर कर रहे थे, अब हम कुछ भी कर सकते हैं. We should try something new. No, there is nothing in trying something of that sort. And over the years, what I have seen is even girls are getting involved into it. Just thinking कि we are all equal, so gender equality इसमें करने की जरूरत नहीं है. Even the boys should not do it, and even the girls should not do it. So there are many other things to enjoy instead of getting abused to such things, which is going to like affect everything of you. Your mental health, your physical health, your social health, everything. And it is going to affect your parents also and your coming family also. So better stay out of it. Don't think कि medical में तो ये होता ही है. No, ऐसा नहीं है. You have to take a step ahead and not get involved into it. ये बात याद रखना मेरी, कभी पूछूंगी मैं वापस कि कितनों को याद है और कितनों ने इस पे वर्कअप किया. Is it clear to everyone? Then reducing stress and improve safety in the workplace, reducing indoor and outdoor air pollution. Yatri Suraksha we had talked about, preventing deaths due to rail and road traffic accidents, Nirbhaya Nari action against gender violence. Then Swasth Nagrik Abhiyan, that is social movement for health. Greater emphasis on school health and school noon meal program, which I told you, school midday meal program होती है, जिसमें रूरल एरियाज में गवर्नमेंट स्कूल्स में खाना प्रोवाइड किया जाता है. इवन कुछ टाइम से a glass of milk is also being given to children over there. More support to ASHA workers in palliative care, community mental health and in village health sanitation and nutrition committee. ASHA कौन होती है? Any idea? Asha is a small form for a bigger word. And हमारे जो सब सेंटर होते हैं वहाँ पे आशा भी वर्क करते हैं. रूरल एरिया and urban area में we have ASHA. So for ASHA the full form is Accredited Social Health Activist. So ये honorarium मतलब they get incentive for whatever work they are doing. Honorarium based होता है इनका. And besides this, yoga promotion at workplace, schools and in community. तो ये फाउंडेशन कोर्स में हम आपकी योगा क्लासेस भी करा रहे हैं because again this is needed for our physical health and mental health. This is very important. So the policy proposes 7 key policy shifts in organizing healthcare services. From primary care, selective care से assured comprehensive care. At secondary and tertiary care, input oriented से we are moving towards output driven. And the public hospitals, user fees and cost recovery से assured free drugs, diagnostics and emergency services. So we all know that हमारी government में अभी government hospitals में we have free drugs, diagnostics and emergency services and integration of national health programs with health systems for program effectiveness. In infrastructure and human resource development, we are moving from the normative approach to the targeted approach. हमारे targets हैं, we need to fulfill those. Ayush system. What was Ayush system? What is Ayush? Ayush stands for Ayurveda, Yoga, Unani, Siddha and Homeopathy. So these are alternative medicines. तो पहले सबका अलग-अलग था. We have tried to bring all of them into mainstream. और हम एक कॉम्प्रिहेंसिव केयर इवन हमारे जो सेंटर्स होते हैं वहाँ पे भी आयुर्वेदा यूनानी इन सब के भी डॉक्टर्स होते हैं. एंड अर्बन हेल्थ टू ऑर्गेनाइज प्राइमरी हेल्थ केयर डिलीवरी एंड रेफरल सपोर्ट फॉर द अर्बन पुअर. So these are certain national health programs. RMNCH plus A services. That is developmental action of all sectors to support maternal and child survival. Then we have child and adolescent health, intervention to address malnutrition and universal immunization. You can see यहाँ पे हम mainly क्या बात कर रहे हैं? Maternal and child and adolescent. Why so? हमारे programs इन्हीं पे क्यों focus हैं? सोचो एक बार. Healthy upcoming generation, yeah. और I give you 5 minutes to think over. I have an important call for you. Why do you think हमने बच्चों पे और मदर्स पे, एक तो है कि हाँ अपकमिंग जनरेशन हेल्दी हो, व्हाट अदर रीजन, और एडोलेसेंस भी है, व्हाई सो? हाँ, वीकर इम्यूनिटी या वीकर इम्यूनिटी और व्हाई यही में क्यों अलग अलग हो? तो लेकिन हम malnourishment को टेक केयर कर रहे हैं, लेकिन what my question is why we are focusing on mothers, children and adolescents? ठीक है, ये बात तो हो गई, इसके अलावा और कुछ? ये तो चाइल्ड और एडोलेसेंट ये ग्रोथ स्पर्ट्स वाले टाइम है, तो दे नीड एक्स्ट्रा न्यूट्रिशन। अगर उस समय उनकी न्यूट्रिशनल नीड्स को टेक केयर नहीं किया गया तो क्या होगा? ना दूसरा, प्रेगनेंसी अगेन नीड्स टू हैव मोर ऑफ इट, क्योंकि दे आर टू इंडिविजुअल्स दैट अ मदर इज नरिशिंग थ्रू हर प्लेजेंटा के थ्रू न्यूट्रिशन जा रहा है ना फीटस में, so that is also pregnant mother and lactating mother, that is the mother who is feeding her child, उनकी भी न्यूट्रिशनल नीड्स ज्यादा होती हैं। और तो हमने बोला न्यूट्रिशनल नीड्स ज्यादा हैं इस समय, दे आर वल्नरेबल, going through many changes, and if they would be healthy the future generation would be healthy। इसके अलावा हाँ या ओके और कुछ? अगर हम चिल्ड्रन, अडोलेसेंट्स एंड प्रेग्नेंट मदर्स या रिप्रोडक्टिव एज ग्रुप में जो मदर्स हैं उनको कंबाइन करते हैं तो दे फॉर्म अबाउट 2/3 to 3/4 ऑफ आवर पॉपुलेशन। तो इसीलिए हमारे जो प्रोग्राम्स हैं वो मेनली इन पे फोकस्ड है, क्योंकि दे फॉर्म द मेजॉरिटी पार्ट ऑफ आवर पॉपुलेशन हु आर इन नीड ऑफ केयर, वल्नरेबल एंड हैव हायर न्यूट्रिशनल नीड्स। I hope everybody got it. Why we have programs mainly focused on this age group. Then communicable diseases, we need to control them. अभी आप लोगों में से एक ने बोला भी था, and because we are moving towards developed country, तो हमारा जो trend of diseases है, it is shifting from communicable to non-communicable. So non-communicable diseases, we need to halt them also. Mental health, for this we have National Mental Health Policy of 2014, because this is again a very very important thing. आप सब लोग ही देख ही रहे होगे और सुन भी रहे होगे what is happening in Kota. Every now and then there is a bad news from there for about students. So we need to take care of the mental health and population stabilization. As I told you, we have moved from second to first. फर्स्ट आना अच्छा होता है, लेकिन हर चीज में फर्स्ट आना अच्छा नहीं होता ना, कि हम पॉपुलेशन में फर्स्ट आ रहे हैं, दिस इज नॉट समथिंग गुड। सो वी नीड टू टेक केयर ऑफ दिस, वी नीड टू स्टेबलाइज आवर पॉपुलेशन ऑल्सो। सो विद दिस आई finish off the national health priorities and the policy that we have in India. I hope everybody is a bit sensitized about what are our national health priorities and what are the policies. एनीथिंग दैट यू वांट टू डिस्कस? कोई क्वेश्चन आ रहा हो दिमाग में कि ये चीज भी हमें पूछनी है, या यू, हाँ, या व्हाट इज पैलिएटिव केयर? पैलिएटिव केयर का मेनली होता है जैसे जो हमारी लॉन्ग टर्म वाली डिजीजेस होती हैं, क्रोनिक डिजीजेस, जैसे कैंसर है, तो उसमें पेशेंट को हम डिजीज को मैनेज कर रहे हैं, ठीक है। अगर मान लो बहुत प्रोग्रेसिव स्टेज में कैंसर है, पेशेंट बेड रिडन है, तो हमें क्या टेक केयर करना है कि उसके बेड सोर्स नहीं बन जाएं, उसका न्यूट्रिशन प्रॉपर होता रहे, उसकी मेंटल हेल्थ प्रॉपर रहे, विल पावर थोड़ी सी स्ट्रांग रहे, थोड़ा सा मोबाइल रहे पेशेंट, कि वो अपनी एक्टिविटीज खुद कर पाए। सो दैट इज दिस पैलिएटिव केयर का रोल आता ही क्रोनिक डिजीजेस में, जो लंबा टाइम डिजीजेस चल रही हैं, तो उसमें हम क्या कर सकते हैं कि उनकी लाइफ की क्वालिटी बेटर हो सके। अच्छा, अटेंडेंस शीट कहाँ पे है? एवरीबडी हैज साइंड इट? करो जल्दी जल्दी, पास ऑन करो।